The Sandy Springs Community Paramedicine Program is an innovative healthcare initiative that extends the role of emergency medical services beyond traditional 911 responses. This proactive approach enhances healthcare access, reduces unnecessary hospital visits and 911 calls, and helps prevent emergency situations by providing preventative and ongoing care.
My name's Patrick Flaherty. I'm the Chief of EMS for Sandy Springs Fire Department, and I'm happy to be here sharing information on our Community Paramedicine Program with you today. Our Community Paramedicine Program is a new initiative from Sandy Springs Fire. Its goal is to reduce the wear and tear and the high frequency, low acuity, or low priority EMS calls that come in through our 911 system. Our community paramedic reaches out to all of our independent living, assisted living, and nursing facilities in Sandy Springs with the goal of helping educate its residents on when to call 911, different plans and procedures that they can use to reduce the needed calls for 911, help them take better care of themselves, how to take their medicines, how to better recognize signs and symptoms that do warrant a true emergent 911 response.
My name's Paul Long. I'm the Community Paramedicine Officer for the City of Sandy Springs. They brought me on to develop, implement, and get the Community Paramedicine Program going. I have a little more than 25 years experience as a paramedic. 22 years of that I was a firefighter. Did a little bit of everything, but most all of it has been related to 911 response. Most of the time 911 calls come out, we go, we pick them up off the floor, off the street, we get them to the hospital, drop them off, and that's the last we see or hear from that. Now to have an opportunity to really interact and help bring resources and more long-term help to folks that need it, something that's been really fulfilling for me in the new role.
Micah was walking to school, and I was actually on the phone with him. My heart just dropped. I was in shock. It was horrific because he was laying in the middle of the street. I didn't know what to expect or what was happening, how this happened. It was the worst day of my life. The very first week that Micah was home, he had an appointment. We were on the 3rd floor. We couldn't be careless getting him down the stairs or jostle him. So through the Sandy Springs Paramedicine Program, we were able to get not only help from the firefighters, but also from Sandy Springs community. And that's when I met Paul, who, really was there for us from day one all the way through.
Sandy Springs is very lucky to have some of the best equipment that I've worked with, and one of the items that I carry around in my vehicle is a powered stair chair. Literally with the push of a button on a set of tracks runs up and down the stairs.
It was a really good experience when all the firefighters came, and I liked the machine that took me down the stairs. It was really cool. And just having the firefighters to come and help and always be on time, like my mom said, was a really good experience. And I just liked it a lot. And all the firefighters and Paul, they were really nice.
So Paul was there to help me to navigate through this entire nightmare. And without him helping me to coordinate the transportation, and he's a pro, this is what he does. He knows how to get results. He had the resources to help us and support us, and he did exactly that. And he did every single time go above and beyond. So, my heart is filled with hope and promise. And Micah had a goal and a dream of going to school, 9th grade, first day, walking in school without, and not having a wheelchair or a walker, any of that. And he was able to do that successfully.
If you or someone you know could benefit from the Sandy Springs Community Paramedicine Program, please reach out.